Welcome class. This is Dr. Ritu. Today, a topic of discussion is about diuretic agents. We will discuss them in detail. Now see what is relevance of this topic in your exam. It will be covered in your paper as a long question or maybe as a short note. At objective level, you should know what is diuretic, their chemistry, and therapeutic uses. And at objective level and at subjective level, we discuss classification, mechanism of action, and their structural activity relationship. So, diuretic, also known as water pills. These drugs increase the rate of urine formation, and this process is called diuresis. So diuretic drug also increase urinary excretion of sodium ion and water from the body. They act by decreasing sodium reabsorption, at different site in nephron. Nephron is a structural and functional unit of the kidney. So diuretic, they act on the kidney. The nephron have 5 major reasons, and they have specific function. So these reasons, the first is Bowman's capsules. Bowman's capsules surrounding by network of blood capillaries. By surrounding by network of blood capillaries, and this capillaries help to filtrate the blood. And the glomerulus take this filtered blood into the proximal tubules. So the proximal tubules reabsorb electrolyte, glucose, bicarbonate, and some amino acids. And this filtered blood that goes to the loop of Henle. This part is Henle. So loop of Henle have 2 distinct parts, that is descending limb of loop of Henle and ascending limb of loop of Henle. So the descending limb has permeable to water but impermeable to the sodium ion. And the ascending limb of loop of Henle have opposite function, that is permeable to sodium ion but impermeable to the water. So 25% of sodium ion reabsorbed passively by the loop of Henle. And the last major part of this nephron is a digital tubules. So digital convoluted tubules permeable to water but impermeable to the sodium ion. So this is the basic physiology of the nephron, because at this part the diuretic drug act. Okay, clear to everyone? So some therapeutic uses of diuretic, that diuretic find application in different clinical condition, from hypertension to edema. Edema is a condition in which fluid accumulated in the body, So this edema condition, this edema is also related with various disease, including heart failure, hepatic disease that is related to liver, and the renal disease that is related to the kidney. So in all these conditions, the fluid can be deposited into the body. So diuretic help to mobilize this fluid from the body with the help of excretion. Okay. So these are the main uses, these are the main therapeutic uses of the diuretic drug. But diuretic drug also uses in the cases of overdose or poisoning, excretion of certain substance, certain poisons from the patient's body. So these diuretic also have some therapeutic action, some uses to in the cases of the overdose. Okay, it is clear to everyone. Okay, now we discuss the classification. The next slide is related to the classification. So diuretic agent can be classified on two bases. First on the basis of structure and the second on the basis of site of action. So on the basis of structure, the first category is a xanthine. Are you familiar with that, this xanthine? So student, can you tell me from which chemical class xanthine belong? Yes, Priyanshu.
The purine base ring and xanthine is
Okay.
an alkaloid.
Okay, right, Priyanshu. So xanthine belong to a purine base, and this xanthine are a group of alkaloid. Okay, right, Priyanshu. So xanthine is a alkaloid, is an alkaloid, and the example of xanthine category is drug is caffeine. So caffeine used as a diuretic. The second category related on the basis of structure, that is carbonic anhydrase inhibitor. Carbonic anhydrase is an enzyme. It is responsible to also increase the some problem related to edema and also related to hypertension. So the drug which inhibit the carbonic anhydrase enzyme is called acetazolamide. So acetazolamide is an example of carbonic anhydrase inhibitor drug. The next category is called acidifying salts. So also called acid forming salts. Example is ammonium chloride. Ammonium chloride had been used as a diuretic for many years before the development of currently used diuretic like thiazide, like carbonic anhydrase inhibitor. So this drug used for many years as a diuretic. The next category and very important category of diuretic drug, that is thiazide. So thiazide drug, these are basically thiazide drugs structurally related to antibacterial drug of the sulfonamide class. But these thiazide drug don't have antibacterial activity. Only structure resemble with antibacterial drug like sulfonamide, but they don't have any antibacterial activity. The example of thiazide diuretic is a chlorothiazide. So chlorothiazide is a drug of category thiazide. The next category of classification is a high ceiling and also called loop diuretics. The example of the drug is furosemide. So high ceiling compounds have highest efficacy among other drug of diuretic. They mainly act on the thick ascending limb of the loop of Henle. Because thick ascending limb is permeable to sodium ion but impermeable to water. So this high ceiling or loop diuretic inhibit active reabsorption of chloride ion, sodium ion, and potassium ion, and they give their diuresis action. Okay, the next category related to the structure is osmotic diuretic. So osmotic diuretic, these agents are low molecular weight compound. And the next or last category according to structure is a potassium sparing diuretic. So potassium sparing diuretic, these diuretic are a antagonist. So antagonists are the drug which they do not have their action but antagonize the action of other agonist. So in this case is aldosterone. So aldosterone hormone is act as a agonist in this case. So drug compete with aldosterone for the receptor site and inhibit the sodium channel block and inhibit the sodium channel. So sodium ion inhibit, and these drugs act as a diuretic. Okay, so this is the drug on the basis of structure. The next category of classification on the basis of site of action. So on the basis of site of action, the drug divided into three categories. Some drug act on the proximal tubule. Proximal tubule is a part of nephron, is a major part of nephron. And the drug which act on the proximal tubule is a osmotic diuretic, example mannitol, xanthine, example is caffeine, and carbonic anhydrase inhibitor drug, acetazolamide, and some acidifying salt like ammonium chloride. These all drugs act on the proximal tubule. So for these drugs, the site of action is proximal tubule. At this place, the drug act. The next category on the of this classification is the ascending limb of the loop of Henle. So the high ceiling or loop diuretic, example is furosemide drug, act or at this place. And the last major part of the nephron is a digital tissues. So thiazide drugs and potassium sparing diuretics act on the digital tubule. Okay, so clear the classification. Now we discuss the first category, that is xanthine. So xanthine drug used as a diuretic. In this category, this is the basic structure of xanthine. So in the xanthine structure, for the structure of caffeine, we can place that is some numbering. We start from the numbering. We start from the at this point 1, 2, 3, 4, 5, 6, 7, 8, and 9. So for the structure of caffeine, we place CS3 group at R1 position, at 1 position, and at the 3rd position, and at the 7th position. So we can write for the caffeine is 1, 3, 7 trixanthine. Okay, it is clear. So the for the caffeine structure, we can place at this place, we can add CS3 group, and if at this place at the 3rd position, we can also add the CS3 group, and at the 7th position we also add the CS3 group. So for the caffeine structure, we can write 1, 3, 7 trixanthine. So this is the caffeine structure. It is clear to everyone? Okay, so caffeine and its other derivative related to xanthine, that is theophylline, theobromine, are the most consumed drug in the world as a diuretic. Okay, so these drugs act by increasing cardiac output and promoting a higher glomerular filtration rate. So in the nephron structure, we also see the glomerular filtration. From this part, the filtered of electrolyte, glucose, bicarbonate, sodium ion. So these drugs act at this place. The theophylline, the prototype xanthine, is known to promote a weak diuresis by stimulation of cardiac function and by a direct action on the nephron. So these drugs directly act on the nephron. So that's why these drug a weak these drugs have a weak diuretic actions. Okay, now we discuss the mechanism of action of these xanthine derivative. So theophylline exert its diuretic action by inhibiting sodium ion reabsorption. So these theophylline drug inhibit sodium ion reabsorption. So sodium ion reabsorption is inhibited. So sodium ion can easily excreted with the help of urine from the body. These drugs act on the proximal convoluted tubules, theophylline, and the xanthine other derivative also act on the proximal convoluted tubule. So its site of action. These drugs increase cardiac output and promoting a higher glomerular filtration rate. Okay, so this is the mechanism of action of xanthine derivative, especially theophylline drug. Okay, now we discuss the next category, that is carbonic anhydrase inhibitor. So carbonic anhydrase inhibitor drug example is acetazolamide. So for the acetazolamide, this is a drug act as a inhibitor of this enzyme, carbonic anhydrase enzyme. This is a structure of acetazolamide. So some points related to structural activity relationship of this drug, that is sulfomyl group. This is a sulfomyl group. This this is the sulfomyl group, and this sulfomyl group is essential for the activity. So for the activity of the drug, this sulfomyl group is essential. Okay, if we replace this sulfomyl group, the activity of the drug is decreases. So for the activity of the drug, this sulfomyl group is essential. The next point of structural activity relationship, that is related to sulfomyl nitrogen atom. So at this sulfomyl group, the nitrogen atom at this place must be unsubstituted. So at this place, no functional group, no other atom can be attached for the activity. So this nitrogen should be free for the activity of drug. The next point, that is related to the substitution of methyl group on one of the ring nitrogen. So if we add some substitution at the one nitrogen like methyl group, the carbonic anhydrase inhibitory activity is increases. So in the structure of methazolamide, the methyl group is attached at this place. So at one nitrogen, we can add some functional group like methyl group for the activity of the drug. But at this nitrogen, we cannot add any functional group at this place. Okay, clear? Now we discuss the mechanism of action. So for the mechanism of action, before we start the mechanism of action of acetazolamide, first we discuss the functioning of the enzyme, carbonic anhydrase. So carbonic anhydrase enzyme convert bicarbonate ion So this enzyme, carbonic anhydrase enzyme, convert bicarbonate. This is a bicarbonate ion. It converted into CO2 and CO2 and water plus water. Okay. So this is a normal functioning of the enzyme. Enzyme is carbonic anhydrase. In the normal functioning of the carbonic anhydrase, bicarbonate ion is converted into carbon dioxide and water. But when the acetazolamide drug acts on this enzyme, the function of this enzyme is inhibited. So this enzyme inhibition of carbonic anhydrase by acetazolamide result in an increased urinary loss of bicarbonate. So bicarbonate can not converted into carbon dioxide and water, and it is excreted from the body with the help of urine. So this also acetazolamide drug also interfere with the reabsorption of sodium and chloride ion. So with the bicarbonate ion, sodium ion and chloride ion also excreted from the body. Okay. As a result, the sodium ion along with bicarbonate ion are eliminated in the urine and diuresis action is produced. So diuretic action of acetazolamide produced with the help of inhibiting the enzyme carbonic anhydrase. Okay. Now we discuss the next drug, that is osmotic diuretic. So osmotic diuretics drug, it is a radially filtered by the glomerulus filtration without being reabsorbed by renal tubule. Okay, that's why osmotic diuretic used as masking agent in sports person. So sports person can be used osmotic diuretic for masking agent. Some sports person used it to hide or prevent detection of a banned substance or illegal drugs like steroid drugs. So these osmotic diuretic also as a masking agent in sports. These osmotic diuretic do not interact with receptor. These drugs not interact with the receptor. These drugs directly block renal transport. They directly block the renal transport activity dependent on development of osmotic pressure. So some example of osmotic diuretics are mannitol, urea, glycerol, isosorbide, etc. So mannitol is a osmotic diuretic. Mannitol is a sugar alcohol. It is a sugar alcohol that does not radially cross cell membrane. As a result, it can induce an osmotic diuresis when administered by intravenous infusion. Because these drugs have a poor crossing ability for cell membrane, that's why it is not given by oral route, it is given by intravenous route. So intravenous route is a type of parenteral route. That's why this drug given by intravenous route, not by oral route. Okay. So this is the structure of mannitol. Mannitol is a sugar alcohol. Now the mechanism of action of osmotic diuretics, they are hydrophilic. They are hydrophilic drug. What is hydrophilic? What is hydrophilic? What is hydrophilic? They are hydrophilic. So what is hydrophilic? Anjali answer that is water soluble. Okay, right, Anjali. So hydrophilic means that is water loving drugs. So these are hydrophilic in nature, that are easily filtered through the glomerular filtration with little reabsorption and thus increase urinary output via osmosis. So in this process, the osmotic pressure is also involved. So these drugs easily filtered through the glomerular filtration. Okay. Next, the category of the diuretic is a thiazide. So thiazide is an important drug. These are important diuretic drug. These drugs are also used as an antihypertensive drug. So in this category, in the category of thiazides, most of the diuretic of the thiazide class are structurally related to the antibacterial drug like sulfonamides, but they do not have the antibacterial activity. But their structure are resemble to the antibacterial drug. So this thiazide drug divided into two class, that is thiazide diuretics and hydrothiazide diuretic. Okay, so these thiazide drug divided into two category, that is thiazide category and second is the hydrothiazide diuretics. So thiazide diuretics, this is the structure of thiazide diuretics. These drugs administered orally, and thiazide are rapidly absorbed and diuretic effect is seen. But the chlorothiazide not given orally. In the all category of thiazide, the all drugs are given by oral route, but the chlorothiazide not given by oral route. In the base, this is the basic structure of thiazide diuretics. So at this place, at this R1 place, we can add chlorine atom. This chlorine can be added at 6th position for the structure of thiazide, and at the R1 position, we can add the H atom. We can add the H atom at the 3rd position. Okay, it is clear. So for the chlorothiazide structure, in the basic structure, we can add chlorine atom at the 6th position and H atom at the 3rd position. It is clear to everyone. The second category, the second example of this category is flumethiazides. So for the flumethiazide, at the R position, at the 6th position, we can add CF3 group, and at the 3rd position, we can add H atom. So this is the structure of flumethiazides. Okay, clear to everyone? The next category is called hydrothiazide. So for the hydrothiazide, two drugs of this category. First is hydrochlorothiazide and the second is hydroflumethiazides. So for the hydrochlorothiazide, at the R, at the 6th position, Cl is attached, and at the 3rd position, H atom is attached. And the second drug is hydroflumethiazide. At the 6th position, CF3 group is attached. This CF3 group attached at the R position. Okay, at the 6th position. And for the R1 position, the H atom is attached for the structure of hydroflumethiazide. Okay, so for the structural activity related point, for the SAR point, some SAR is a structural activity relationship. So some SAR point is also important for the this drug. So first point related to structural activity relationship, the first group is SO2 group. Okay, this SO2 group at the 1st position. So this SO2 group can be replaced with CO group. Okay, so at this 1st position, we replace this SO2 group with CO group for the activity of the drug. So when we add this CO group at the first position, the activity of the drug is increases. Clear to everyone? So this CO group can be used to increase the activity of the drug. Okay, the first point is clear to everyone. It is clear to everyone. Now we discuss the second point of structural activity relationship. So the second point related to structural activity relationship, that is second position. So at the second position, nitrogen group is attached. So substitution of this nitrogen atom at second position with methyl group, at the second position, at the place of H atom, we can add methyl group. We can add at the second position, this is the methyl group, the activity of the drug is increases. So we can add methyl group at the second position, at the second nitrogen, methyl group increase the activity of the drug. So in the some structure, you can also see the methyl group can attached at the second position at the second nitrogen. Okay. So this is the second point. This is the second structural activity relationship points. Now we discuss the third position. At the third position, the R1 group is attached. So R1 group, like H atom, in the structure of chlorothiazide, the H atom are attached at this place. So at the third position, the hydrophobic group are added to increase the diuretic activity. Diuretic activity means it facilitating the renal excretion of sodium ion. So at the third position, we can add some hydrophobic group to increase the diuretic activity of the drug. Okay, so at the third position, we can add some group like CH2Cl, Also, we can add CHCl2. So this group can be add at R1 position, at the third position, to increase the diuretic activity of the drug. Okay, clear this point? Clear? Now we discuss the next structural activity point, that is related to third and fourth position. So at third and fourth position, you can see this is a double bond. This is a double bond in the structure of thiazide diuretic, but in the structure of hydrothiazide, this double bond is replaced. This double bond is removed in the structure of hydrothiazide. So this double bond, so the saturation of this double bond at the third and fourth position, yani ki, saturation of the fourth double bond increase activity. You can saturate this double bond. Okay, so at this place, third position and the fourth position double bond is exist. So the saturation of this double bond increase the activity of the drug. So we can find out the hydrothiazide drugs. So in the hydrothiazide drug, this double bond is replaced, and this double bond is replaced by adding this H atom at the fourth position, because the numbering of the nitrogen is completed. So we add the H atom at the fourth position. Okay, clear? The next point related to free sulfonyl group. So this is the 7th position group. This 7th position group is called sulfonyl group. So a free sulfonyl group is essential for the activity. So this 7th position group, that is called sulfonyl group, is essential for the activity. So these are the structural activity point related to thiazide diuretic. Okay, clear to everyone all these points? The first position, that is SO2 group, can be replaced with CO group. The second position, the nitrogen, at the second nitrogen atom, methyl group can be added for the activity of the drug. And at the third position, hydrophobic group are attached for the activity of the drug. And at the sixth position, the next one important point is also related to the SAR point. So at the sixth position, this position, that is substitution at sixth position by Cl, Br, or CF3. Okay, so in the structure of flumethazide, you can see that at the place of sixth position, CF3 group is attached. So at this point, substitution in the sixth position by Cl, by Br, or by CF3 increase the activity. Okay, so this sixth position point is also important related to structural activity relationship. Okay, now we discuss some or other points related to the mechanism of action. So mechanism of action is also important of thiazides. So thiazide diuretics, these diuretics are secreted into the tubular fluid by the proximal tubule, but their site of action of thiazide diuretic is digital tubules. These drugs act on the digital tubules. Okay, so for the mechanism of action of the thiazide diuretic, these thiazide diuretic, these drug with the help of they transport with the help of symporter. So symporter, in this process, any 2 ion or 3 ion move in the same direction through the cell membrane. So in the mechanism of action of thiazide diuretic, these act in the digital convoluted tubule and block the sodium ion and chlorine ion symporter. So this symporter help to move some ion in the same direction in the normal functioning. But when the drug act at this symporter, they block the sodium ion and chloride ion movement through the cell membrane that is associated with the luminal membrane. Okay, so this transport system moves both sodium ion and chloride ion into the cell using the free energy produced by the sodium ion, potassium ion, ATPase. Okay, so the sodium ion is pumped out of the epithelial cell via this transport system with the help of this symporter system in the basolateral membrane, and the chloride ion exits the cell via a chloride channel. So thiazide diuretic, these act by these block the action of sodium ion, chloride ion symporter. Okay, and they give their diuretic action. Okay, clear to everyone? This is clear to everyone? Okay, this is the mechanism of action of diuretic, thiazide diuretic. Okay, so at that part, this is a symporter, sodium ion, chloride ion symporter, and with the help of this importer, sodium ion and chloride ion enter into the cell with the help of cell membrane. But when the drug act at this part, they block their action, and they inhibit the sodium ion and chloride ion reabsorption. Okay, clear? And the diuretic action is reduced. Okay, now we discuss some therapeutic uses of the thiazide diuretic. So thiazide diuretic are used in the treatment of hypertension. Hypertension means that is high blood pressure. So and as an antihypertensive agent, thiazide as an antihypertensive agent, the action of the thiazide can be explained by their diuretic actions, that is by lowering the volume of circulated blood, and they give their antihypertensive action. And they also used in hypertension as well as mild heart failure. Thiazide diuretic enhance the effectiveness of most other antihypertensive agent. So thiazide diuretic used individually, but they also used in the combination of other antihypertensive agents. They are also used in the combination for the better activity of as a antihypertensive agent. It also used to mobilize edema fluid. Edema is the condition in which the body fluid is accumulated um, accumulated into the body. So the thiazide diuretic mobilize edema fluid associated with renal problems, hepatic, that is also some problem related to liver, and some cardiac dysfunctions. So in this condition, when the edema when the fluid is deposited into the body, this condition is called edema. So diuretic drug help to mobilize this edema fluid from the body in the form of urine. And other therapeutic uses of the thiazide diuretic, it is also used in the management of diabetes insipidus. So in the case of diabetic insipidus, the thiazide diuretic is also used. So this is the therapeutic uses related to the thiazide diuretics. But some thiazide diuretic also have some adverse effect. These adverse effect like hypokalemia. So some adverse effect related to the thiazide diuretic, that is hyperkalemia. Not hyper, that is hypokalemia. 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 It is also have some adverse effect like hyperuricemia, that is hyperuricemia. And also have some adverse effect like hyperglycemia. So also have the side effect like hyperglycemia, that is okay. So hypokalemia, hyperuricemia, and hyperglycemia, some adverse effect also related to the thiazide diuretic. Okay, this is thiazide diuretics completed. If you have any question on thiazide diuretic or other diuretic, you have any question, you can unmute and ask question.
Yes, ma'am.
Yes, Priyanshu.
मैम अगर डायूरेटिक देते हैं तो क्या उससे वाटर लॉस जैसे ज्यादा हो रहा है तो क्या डिहाइड्रेशन की प्रॉब्लम हो सकती है?
Okay, in the certain medications such as diuretic lead to dehydration, generally because they causes you to urinate more. So in this case of diuretic can lead to dehydration as well as some other side effect like hypokalemia, hyperuricemia. So in this case, never take diuretic without doctor's guidance because they cause dehydration.
Okay,
Okay,
ma'am.
any other questions? I hope Priyanshu, it is clear to you.
Yes, ma'am.
Okay, any other questions? Any other question? So in case you have any questions, you can unmute and ask question. Otherwise, I end the session.